Hello, today we'll discuss in brief about the hair transplant. So, hair transplant is a treatment option we usually give to the clients who have the baldness. There are various grades of baldness, which ranges from grade 1 to grade 7, which I don't want to go in detail. But as you know, friends, there are two types of hairs in the head or a scalp. Like one is permanent hairs and another one is temporary hairs. Temporary, I meant to say the androgen sensitive hairs, and permanent hairs, I meant to say mean the androgen resistant hairs. Usually, the androgen resistant hairs are on the back of the head, like from the occipital area, from this to this side, from one ear to other side, and then the androgen sensitive hairs on the top of the scalp, like this part. So usually people lose their hairs in the androgen sensitive area in their lifetime. And you might have seen the people who are bald old people like around 60, 70 years old. They have the strip of hairs in the back side. Those are the permanent hairs. So in hair transplant, what we do, we take this permanent hairs and we place it in the area where we need it, like in the bald area. So there are two techniques which we usually commonly follow. One is the FUT and FUE techniques. In FUT techniques, we take a strip of skin and from there we harvest the grafts and we place it in the recipient area or in the required area. And but in the FUT technique, the people usually have a small incision mark around the back of their head. But in FUE technique, we use the micro punches to harvest the grafts. And with this punch, we take the grafts and with the small slits in the scalp, we place the graft. So this FUE technique is the technique which we call as scarless technique.